We're here talking about 5 years since the start of the COVID-19 pandemic. What are your takeaways? How far we've come, thoughts looking back on what we went through?
I think the first thing I was very proud of early on in the pandemic is how much we were able to prepare. And when society works together, government, private industry, healthcare professionals, public health officials, we prepared so well. And I was immensely proud of our health system and others in the region. We prepared as much as possible, and we gathered information through virtual tools, through social media of those places that were affected before us. For example, India, China, Italy, and New York City was hit hardest beforehand. But we used that time in a very concerted manner. And when society works together, it's amazing what we were able to do, from telemedicine to all kinds of preparations, to all kinds of planning, precautions, getting equipment. And that was just a very important lesson of what we can accomplish when we all work together.
You were one of the first people to get vaccinated from Atrium Health. Can you talk about that day and what that meant to you?
You asked me about a very important moment in my life. It was a very dark time. I mean, we saw so much suffering in the hospitals, outside the hospitals. I have family in India, which got devastated by COVID. And so to watch all this happen in front of your eyes, and some of the suffering that we saw was really hard. It was a very gloomy time. I think I mentioned to somebody that I signed more death certificates during those 2 years than I did my entire critical career combined. I mean, just the level of heartache was hard to see. So then you have the vaccine, and that, to me, that was like the brightest moment in a very dark year. So I was thrilled to be vaccinated. I was on cloud nine. Because I felt really honored and really privileged that our system went and got the vaccine as early as possible and distributed it as widely as possible to everybody who wanted it. Yes, is it perfect science? At some point you have to have a leap of faith, right? But when you see vaccine misinformation and mistrust be so rampant, that does get me a little bit concerned, because I feel a lot of admiration for the scientists and the people who studied in their entire careers and lives to make these vaccines so that we don't have to suffer from diseases. And I come from a country where a lot of those vaccines, when we were children, weren't available, right? And many parts of the world don't have access to these things. So it's hard to watch people who have access to these things, I look as a privilege, turn down a privilege. And so I'm hopeful that we can further the scientific community, strengthen that trust, and get the public to trust what is happening.
What are your hopes for what society takes away from the pandemic and maybe could use in the future should we ever have to face an obstacle like this again?
I remain hopeful that we've learned some important lessons from the pandemic, that the medical and scientific communities and others will work together to make our society healthier. And for me, that gives me a lot of hope. I'm very hopeful for the teammates that I have who are constantly working to improve people's health and their lives. And I'm very grateful for the medical innovation and technologies that we have today, especially at Atrium Health in Charlotte. I mean, I can't be more proud of the stuff we're able to do every day. So that's great. What I really want to see is hopefully people dial down the temperature in terms of the amount of emotion that some of these conversations bring, and let's have an honest, objective conversations about what is great for the larger society at large.
I mean, we've talked, of course, looking back on how it was such a dark time for so many people, but there must be some bright spots that you took away from this pandemic, maybe some great stories of recovery and survival.
So what was really heartwarming, it was like early on the pandemic was tough, but when you started to see people survive, you started to see people walk out of the hospital, that was phenomenal. That was great. You started people get their lives back again. And as a pulmonologist, I could see some of them in my office later on, and they're like, they can breathe, they can get back to society. It took them a little while, but with some heart and some support and some perseverance, it was amazing to see some of the people put their lives back together again. And my mom, I mentioned earlier, got sick. She put her life back together again. She's been exercising, walking, and getting back to her life. And that's what we want to see. We want to see people live their lives to the fullest.
we all got through an extremely difficult time together, but you go on and you continue to try to help patients. What goes through your mind when you think about what you learned during the pandemic?
We were put here and do this job because we care about people, and there's someone suffering, someone whose loved one is suffering, and so it brings a sense of purpose. It also brings a sense of importance of understanding aspects of misinformation and how we need to fight misinformation. Medical misinformation, especially today, is rampant. Well, my dad was the same way, right? Didn't necessarily know who to believe, who to go to, and didn't get the information that he probably needed in a timely manner, right? In terms of what precautions to take, what vaccination, when to do the vaccination, all those aspects. And so, yes, I do take that to heart at times. It's not just from a medical scientific perspective, but also a personal perspective. It also means that when we have the next pandemic, which if we have one, it requires us to really be not just innovative in how we do medical science, but how we package that information for the general public, so that we can build trust, so that hopefully we can get back to a point where society is working together, collaboratively. Because when we do that, it's amazing what we can do.
Mm-hmm. Now, I've heard you say the words, the next pandemic, and I'm sure a lot of folks might have their heart stop just thinking about that. I mean, we can never say this will never ever happen again. But what is everyone doing to kind of prepare for that potential?
The potential is there, and I think we have to be vigilant because it's happened once already. There's concerns it might happen again, right? And we just have to be prepared. So things such as supplies of sterilizing equipment, masks, respiratory equipment, all those aspects. The idea of understanding precautions. How do you do societal precautions on a large scale, right? How do you be careful with those aspects? I think those things are important to be mindful. And now, some things worked well, some things didn't work so well. So let's take those lessons that we learned from the pandemic, let's get the experts in a room, let's figure out what this looks like, and let's prepare, and then let's use our scientific infrastructure to really dissect the issues and hopefully be smarter.
Yeah. How do you feel, I guess, confident that we're prepared to take on another one if we have to, or do you think that there's a little bit more work to do at this point?
I think we have in the United States immense talent, immense resources to really do as best a job as possible. Our scientific advancements, the stuff we have even at where I work at Carolina's Medical Center at Atrium Health, the medical care that we can provide is phenomenal, right? And it makes me incredibly proud. What makes it hard is that some of these things require additional degree of political and social congruence and how to map out strategies, how to work together. And what we're seeing right now is happening across society, and our political system seems to be more of people not necessarily working together. And that's concerning, because we need people to work together. Once they start working together, sit in a room and trust each other and actually work together for the common good, then I think we have a great chance to come through. But if we start to sort of second guess of how we're going to handle the next pandemic, of how we not trust each other, how we not trust the medical institutions that were created and invested in by our forefathers, then I think I'm concerned.
Mm-hmm. No, I mean, you talked about the common good, and I certainly remember when the vaccines started rolling out, there was a lot of messaging about, common good meant everyone who could get a vaccine get one. That way we're building immunity within the community, and we're protecting our neighbors by doing this, not only protecting ourselves. I saw that you were one of the first people to get a vaccine from Atrium Health. So I guess I wanted to walk back in time and go through, what was going through your mind at that moment when you were finally getting the shot, and what you were hopeful for in getting the vaccination.
You asked me about a very important moment in my life. It was a very dark time. I mean, we saw so much suffering in the hospitals, outside the hospitals. I have family in India, which got devastated by COVID. And so to watch all this happen in front of your eyes, and some of the suffering that we saw was really hard. It was a very gloomy time. I think I mentioned to somebody that I signed more death certificates during those 2 years than I did my entire critical career combined. I mean, just the level of heartache was hard to see. So then you have the vaccine, and to me that was like the brightest moment in a very dark year. So I was thrilled to be vaccinated. I was on cloud 9. because I felt really honored and really privileged that our system went and got the vaccine as early as possible and distributed it as widely as possible to everybody who wanted it.